as you know, there's a lot of accidents if you're on the bike. So you are like, do I want to stay alive or do I want to look thin? So,
The choices, right? Yeah.
yes.
All right, guys, welcome back to the Rio Grande podcast. My name is Sam, if we haven't met yet. Today, we are spending some time with Dr. Rashmi Chandran, CEO of AltaCair Foundation. Is this like a regional organization or is it nationwide?
It is regional and it focuses on always being regional.
Okay,
Yeah.
so that's the whole point, right?
Yes, just for the 4 counties of Rio Grande Valley.
Awesome. Yeah. So Dr. Chandran is here to talk about. Well, I mean, so the whole point, or like one of the mission statements of the foundation is helping the underserved communities, right? Like in the health
Correct.
space. So
Yes.
I guess that we fall as the Rio Grande Valley. We are some of those underserved communities that the foundation is looking to
Yes.
target.
Yes. So one of the goals is also to change the perspective with which we approach health. When traditionally health was viewed as medicines, doctors, hospital, clinic, checkups, right? Health is not just that. Health starts from where you're living, your neighborhood, who you're surrounded with, the water you drink, the food you eat, your social environment, your economic stability. All of that is health. And that nowadays we call it non-medical drivers of health, social determinants of health. And that is truly what's affecting the actual medical diagnosis of a person. So making people realize that you're not just taking care of your health by going to a doctor, but whatever is happening in your household is where health actually starts.
And it's a direct impact.
It is a very direct impact.
Because you said that can impact medical diagnoses. So you're talking about like if I get diagnosed with liver disease or like with high cholesterol, the fact like my social situation or my like that is gonna directly.
Yeah, I mean, your social situation, your household culture, your lifestyle routine. Sometimes you have parents who eat very healthy, but, you yourself, you are probably studying all the time or working all the time, and all you can do is grab a snack here and there, and those are not the healthiest, and that can shoot up your cholesterol. So all of these things is what impacts the diagnosis. Obviously, you get diagnosed with things in a brick and mortar setting in a hospital or a clinic, but the preventative steps that you can take to not get there starts from your household, starts from within you and the environment around you.
Is that something that has always been understood, or is that more like of a new concept?
It's something that I think has gained more attention in the last 2 decades or so. And more so even in the medical community now, it's becoming more and more evident that people are preaching more preventative measures and believing in educating the patients and community about doing the right lifestyle instead of just talking about taking medications on time.
Okay, so
Yeah.
so I mean it's a lot more than just following up with your doctor,
Yes.
getting your blood work, taking your medicine. Because even if I'm doing all that,
Yeah.
I could still be like there's still room to improve my physical health based on my environmental factors.
Absolutely.
You see, that might be something that we don't necessarily like who's telling us that, like, because I mean, you're not going to take a class about that in high school or in college. So it's like,
I would love to if I'm invited.
right? But how are we supposed to know these things? I mean, I guess that's the whole point of your work,
Yes,
right? To like
yes.
close that. It's like an education gap, maybe.
Yeah. So, believe it or not, we have about 315 or more non-for-profits in our Rio Grande Valley. And a lot of these organizations do this kind of work. It's just that they struggle to find the right platform to increase their scope of work and march forward. And at the same time, there is lack of connectivity for the residents and the community to connect with them. So we're kind of wanting to be that convener to identify tailored communities, find their needs, and bring the organizations who will specialize in those and connect them together. And in between that, if there are gaps that we need to fill as a bridging capital, that's where we come in. We actually go, and it's called gap analysis. We talk to the residents, we speak to the community center where most people will go for, immunization and other help and services, or the faith-based organizations that might be there in that community, and figure out what is the top 3 or 4 needs that community has. And then we contact our partners. We partner with over 100 organizations within the Rio Grande Valley from different sectors: government, for-profit, healthcare, education, faith-based, and non-for-profits. And if any of those organizations are the ones who can meet their needs, we contact them. We put together a community fair where they can get connected. We put specific program and discussion venues to keep those services going. And our goal is as soon as we figure out that or realize that, okay, now the connection has been made, those 3 or 4 needs that we were hoping to meet is getting addressed, let's move on to another underserved community.
I see. So you're identifying the issue, and then the intervention is these other programs.
Yes.
Whereas like a doctor identifies, makes a diagnosis, and his intervention is the medication.
Yes.
The interventions you're thinking of are like social, like environmental.
Yeah, that's a very good analogy. Thank you. I will use that in the future.
Well, because I'm trying to to make sense of all this, because I mean it's one thing like to identify an issue,
right?
But then it's like, what do we do about it?
Right.
But you're tackling both. You're also lining up an intervention, not just figuring out that like maybe I didn't grow up with my parents, and like I'm not able to pay for my light bill, and because of that I don't have a car, so I can't pick up my meds, I can't make my doctor's appointments. But you identify that, and then you do something about it, right? Like
yes.
Okay.
Yes.
So that's pretty cool, because we might not even know, like, and how are we supposed to know that those resources are there though?
Yeah. So what we have done in the last year, in 2024, we did something called cluster meetings, which goes in line with one of our theory of change: listening and advocacy and collaboration. So those were specific to each sector. So we did, like, for example, healthcare sector. We got all the hospitals and clinics together. We asked 2 questions. What are the resources that you all carry that serves the community currently? And what is it that you're lacking? And we collected all that data. We did that with the other 5 sectors. So we have all that data. We're working on a portal, and that portal is actually more than general residents. It's catered to the partners. So if you are a church, right, your First United Methodist Church, and you want to know that, okay, we need lumber, we need, certain other materials to repair a house for 3 families, who are the for-profit businesses that is willing to donate either money or the lumber itself, and how much is their limit? And we hope to have that information with a click for them. That way they have exactly the information they need, and they can contact and continue their project. So that is in motion. It's not ready yet, but we're working on that.
Okay, and that's interesting, because are you talking about lumber for like house building and things like that?
Yeah, because, I think we underestimate our faith-based organizations quite a bit. They have such amazing ministries, and they go out there and do all possible things. There is Methodist ministries that takes food to a lot of these very remote, underserved areas, almost weekly basis. And we're not talking just about canned foods. We're talking about fresh vegetables, fruits, poultry, and fish. So faith-based organizations definitely have a lot of potential to help out if they are able to fill some of the gaps that they have.
I have another question, because I'm trying to figure out where on the health space of a person the foundation lies, like on the spectrum. So is it more of like these interventions are supposed to help me along with my medication, or is it like to prevent me from needing it in the first place?
So, like I said, we are not only going to focus on the medication and actual medical part of it when it comes to health. It's the global totality of it, right? And to give an example of a project that we have already started and in works, there is a place called La Sara in Willacy County. Not sure if you have been there, but a small little town, 20 miles before Raymondville. Doesn't have a grocery store, doesn't have a gas station, has nothing pretty much other than the ISD over there. So over there, when we did the gap analysis, obviously a lot of residents, other than going to one of the, federally qualified health centers, which is where usually people go if they are uninsured or underinsured. Other than that, which is in Raymondville, they don't really have a doctor. And most of them did have some form of an insurance. But since the distance is so much to go to the other facilities, they just go to this place, which is more like an urgent care rather than going to a routine care place, right? So their labs are done maybe once in 2 years, things like that. So now we wanted to take the major entities, the big hospitals to this place. And they were more than willing to come and get connected, wanted to know the place. But they all want a baseline status of how the patients are doing in order to direct them for services. So that is the laboratory services. So we are very supported by Quest Diagnostics. They gave us a grant to do laboratory services. So we did labs for a bunch of residents who came to our community fair. So they had the baseline on whether they're diabetic, they have liver disease, or they have kidney issues or cholesterol. And with that, it was so much easier to direct them that, okay, you need to go here if you don't have a doctor, or even if you have a doctor, go back to your doctor because this is not okay, right? And we have a medical director, so she spent time explaining the results to them and also educating in the process that, do you exercise? And most people say they do. And when you ask them, what do you do for exercising? I water the plants. And so it's like, how is that exercise? Because I sweat, I'm sweating. Oh, you're sweating because there's 110 outside, not because you're doing any kind of cardio. So clarified some of those misconceptions that no, that's not really exercise. You need to be at a certain pace. You ask them about their food. Do you eat healthy? Oh, yeah, I don't eat breakfast at all. And then in the lunch, I just eat two tacos. That's all I do. And then in the night, I just eat sometimes just chips and Coke. That's it. I don't eat. And that's not healthy, right? But to them, I'm eating less. So
it equates in their mind.
Yes.
Yeah. Less calories or something.
Right.
Yeah.
So some forms of education, obviously we cannot go there every single day. So we partner more with the entities that do go there on a weekly basis, which is the Texas Health Department, the Methodist Ministries, the Wesley nurses there. And we tell them what our findings were and, ask them, how do we start helping you all maybe put an exercise program together that you can do, but we'll help you with what you're not able to do. So our goal is to just push the organizations that do the best work in that particular field, but push them in a way that they are filled with the resources that they need to do that, and the community is served.
Okay, and that was like that example was La Sara, right?
That is La Sara.
So, do you just speaking of the valley? Is that like the number one environmental factor, like access to care? Because we're talking about like proximity to like a physician.
Yes.
Or what's the biggest issue that you see that impacts our health here in the valley?
Yes, access is a big one because transportation is a huge issue here. We do not have the best public transport. And we are a blessed region with multiple cities which are not as connected as we think they are. And there's a lot of area which is outside city limit. And most of the people who need these services are outside city limit. So they are surrounded by so many other issues like drainage, sewage, trash pickup, going to work, that health takes a back burner for them. So if they have to drive and utilize their gas for anything, they rather do it to go to work, drop their kids to school,
Oh yeah.
but they won't use it to go to their doctor.
And that's crazy because those are directly impacting whatever medical diagnosis you may have. Whether it's like how indirect or direct it is, it's still a factor that got you to that diagnosis.
Yes.
So then this kind of begs a question, because we're talking about like some of us don't even have like access to transport, or we don't like, we think that watering the flowers is exercising. So then can you tell us like what is health? Like is there like a definition that like to get us a better idea? Maybe we think health is just like not being at the doctor, but like what is good health?
Yeah. So health is so broad, right? It is mental health too. You could be healthy from a physical standpoint, as good as you can, but if you are not mentally feeling well, you are slowly going to be inactive. You're not going to eat the right things. You're not going to worry about yourself or your well-being, and then it's going to take a downfall and come down to your physical being. At the same time, if anybody in your family is affected, that also is going to take a toll on your body. So health on a broad view is how content, how normalized your life is. Wow. If that makes sense.
Yeah. So then like the actual culprit, like the underlying cause of some of our health conditions might not even be like face value, like physical things. It could be like because you're like in bed all day sad, all of a sudden like you're not walking, your heart rate is going up, like, and then you ended up with cardiovascular disease, and you're trying to attack it like thinking physically, but the whole problem is something completely different.
It could be. It has happened. Depression is a big source of a lot of cardiac issues.
Mm-hmm. Physical health gets impacted.
Yeah. It's called psychosomatic factors. Yeah.
And you see, and these are probably things that we just aren't even like,
right.
These are pieces of a puzzle that no one's connecting for us.
Yeah. So that's why, we do this health summit. It's been almost 3 years. This is our third year, called
Health Summit.
A health summit.
Tell us about that.
Yeah. So it's a health conference / summit one day called Accelerator. We did that first in 2023. That was our first year. The first year, what we focused on was from a national lens perspective. There was an article written in New York Times by Dr. Atul Gawande about the Rio Grande Valley, not in a good light. It was written that, McAllen, the hospital systems here are a scam. Doctors get richer and patients are still sick. It's a diabetic capital. It's a obesity capital.
In the New York Times.
And that actually caught President Obama's attention. And that was actually the beginning of starting all these things called value-based medicine, accountable care organization, all of which focused on quality of healthcare instead of quantity of healthcare, meaning this reimbursement for every visit. That concept was kind of wanting to be taken away. Instead, you will get like a fixed amount for a year for a patient. And within that much amount, make sure your patient is okay. It doesn't matter how many times they come to you. And whatever money you save, that's your incentive. So it's called, value-based medicine. So all that came into being. We were kind of an inspiration for that. So whenever, as a healthcare executive, because I worked in hospital administration for a long time, when I would travel nationally, and I would say I'm from McAllen and I'm a healthcare administrator, I would get the look that, oh, you're from there. And I was like, okay, that perspective needs to change, because that was back then and now it's a lot different, and people have worked hard to improve that. We have some really good physician groups, we have good health systems here as well, so that story needs to be told, right? And also the community based organization have done an excellent job. The county does a good job in giving free health immunizations and vaccination preventative care to the residents. So that year we kind of brought the chief information officer from President Obama's term.
Here?
Yeah, we got him here and we got him to present the data from 10 years back and how we do now. And that was like obviously a big positive trend. And so it was a big pat on all the healthcare administrators and government officials. Everybody's back. It was a good celebration. We had a nice panel of roundtable discussion between Judge Cortez, Veronica Gonzalez,
Really?
Manny Vela. Yeah.
So you're saying that the state of healthcare in the Valley is not what it was 10 years ago?
No, it's changed quite a bit, and it's changed for the good. Obviously, we have a lot more to go because we're a special place with, bordering cities, bordering communities. So we are not a cookie cutter place. So we have to think out of the box to get some of our disparities. But yeah, it is a lot better than what it was before.
And you feel that a big part of that change was the change in structure of the reimbursement?
It had a lot to do with that. I think that created a focus from healthcare professionals to think differently, and they did. And they did put a lot of care coordination programs. They also started focusing on that. We don't need to only focus on the patient's blood pressure and vitals. We need to ask them, how are they doing? Is there somebody to give them medication on time, and not just take it for granted that they're going to do it all by themselves. So there's a lot of attention given to the social aspect.
Let me ask you this. In your view, in your expertise, what do you think is the number one driving factor of our our lack of good health in the Valley? Like, is there anything that we need to tackle? Like, because I mean, the practitioners, the organizations, they can do so much, but you know how they say you can take a horse to the water, but you can't make him drink?
Yeah.
So like for us, so that we're aware for ourselves, is there any huge thing that we have an issue with as far as like a detriment to our health?
I think it is as human beings, when something is out of our normal routine, we procrastinate to accept that. And we won't go to a route which we don't know exactly what to do. We'll try to avoid that because there's a lot of unknown and there's questions. So we'll always go with the familiar route. So making things simple, making things understood that it's not complicated, or it's simple to do something. It's not difficult. It's not challenging. It won't take a lot out of you. It won't change your current lifestyle in a detrimental way. If that's communicated well, then I think it makes it easy. So for example, telemedicine, or access virtually to not just medical care, to anything, to education. It's a complicated concept for a lot of people, especially in the rural areas. They think that internet or broadband is not possible. That's not true. There are internet providers that are dedicatedly for the rural areas. Even if there is internet, they think that it's a huge investment to start using things.
So we're making that roadblock on ourselves.
Yes,
we're stopping ourselves because we think we can't.
Yeah, and I think that it's possible to change that with awareness and repetitive instructions. Just a lot of time organizations think that we do one class with somebody and we already did the orientation. It's hard for elderly population to grasp something. I mean, even me, I get scared of new portals. If anybody says, oh no, you have to set up an account on this portal, I'm like, oh my God, another username, another password.
That's
I
true.
don't know how to do this. I don't want to do this. Is there any the way? Even like as simple as a menu, sometimes they tell you to do the QR code. I'd rather have the paper.
That's true. Yeah, and that so you can imagine someone who isn't that connected to the technology. So all these things are what drives like the summit, like and the foundation.
Yeah. So the summit, we try to focus on current day issues each year. So this year, very excited. We have an awesome keynote. His name is Delvecchio Finley. He's the president of Atrium Health. Atrium Health is a big hospital health system. We don't have it in the Valley, but very reputed non-for-profit. And he's the president. So very excited to have him here. He's also been the past chair for American College of Healthcare Executives, which is an organization we all look up to as healthcare administrators. To get a fellowship of that organization is considered like the epitome of getting administrative credentials. So he was a past chair of that as well. So very, very knowledgeable, having an international perspective on health and community initiatives. So he's the keynote. We have 2 strong roundtable discussions. The first one is focusing on food, transportation, and the other social determinants of health like poverty, education. And the second one is focused on women's wellness, pediatric health, dementia, Alzheimer's, things like that. So very, very catered specific topics of discussion. And we hope to connect the dots between policies, access, and outcomes by these discussions. We are also having breakout sessions after lunch where we can do action plans. So we had all this discussion, we had all the Q&As. What are we going to do with it? Okay, so come on, which organization wants to be part of which bucket? Let's plan that and let's plan the next steps.
Okay.
Yeah.
And who should be going there? Is it like for community lay people or is it for professionals?
It is for actually everyone. So if you are government, you are in a community-based service, you're a for-profit also that is here in any of these 4 counties, you are a resident who wants to make a difference, you're a teacher, you're into education, you are a student who wants to figure out what can I do in future to create an impact in my community, which profession would be good for me. For all of them, I think this is all-in-one health summit. I know it says health, so you're again thinking about medicine and healthcare, but health in a globality of it. So if you're into food service, you will benefit from being here quite a bit.
Right?
Yeah.
That's why I wanted to like help defining it because it's a bigger spectrum than just like how's your blood pressure.
Exactly.
So then it's a public thing. Like anyone can go.
It is. And the registration is free.
In Harlingen, right?
It is in Harlingen Convention Center, September 4th from 8 o'clock until 3:30. After lunch, we have the breakout sessions. So even if you want to just attend the morning session with the speakers, you're more than welcome to do so. In the afternoon, the 3 breakout sessions, as I mentioned, was the action plans one. The other one, which is a big one, which is why we have the post-afternoon session from 1 o'clock to 3:30, is poverty simulation. And that has limited seats. We already have about 50 people signed up. We only have 30 more seats.
Poverty simulation?
Yeah.
What is that all about?
Okay, I'm in love with that program. So we did that one time in June with in partnership with First United Methodist Church. So have you ever done a simulation of any sort?
Yeah. Well, so I work in healthcare, so like code blues and things like that. But,
so you're playing out the scenario, right? If something like this happens, what do you do? Mm-hmm. So this is like putting people through the scenarios of actual poor families.
Okay.
So we have it's an actual certified kit which
Oh.
has like role play to each person in the family. So for example, we're a family of three and a single mother with three kids, and we live in an apartment, and the rent went up.
And you play that role.
Yeah, you play that role. So there is like each 15-minute session is 1 week in your life of yourself and your family.
What?
So in between this, you have to go to work, you have to send the children to school, you have to feed them, you cannot leave underage kids unattended, you only have so many transportation passes, you can only pawn so many things, and you just have to make it happen. And so it's really interesting, and it is eye-opening for people who always tend to think, oh, I know, I can sense it, how it feels to be poor. And then you play that role and you're like, oh my God, like this is tough. Right. So we did that, like I said, one time in June with people from different sectors. And the debriefing was so eye-opening. Everyone said that, going to the doctor was the last thing on our mind because, we barely were able to feed the kids. And the other thing was transportation, again, was expressed as the biggest challenge. And that's what we see in the real life scenario here.
I never heard of a poverty simulator.
Yeah.
That must be like, so you're literally stepping into the shoes of true poverty.
Exactly.
I can imagine the perspective that'll give. And that's available there at that?
Yes, that is available after lunch in Accelerator. So I encourage whoever wants to get an experience to be there.
And anyone can show up, right? You said for these, any type of person, no matter where you land.
Yeah, it's open for everyone. As a matter of fact, we also have a good amount of attendees from out of state, out of the valley as well. So if you want to network with different organizations from all around the country, you want to come for this. And yes, anybody can register. Registration is important because, like I said, we are limited in our capacity, especially for the poverty simulation. So for that one, if we are done with our registration and then you show up, unfortunately, we won't be able to accommodate you.
That makes sense.
Yeah.
That makes sense. Let me ask you something. So, I mean, like as CEO of this foundation, I guess I want to pick your brain a little bit here. What do you want to see in the community here in the Valley? What do you want to see in the Valley to know that this has made an impact, or that the foundation, the summit, all these resources? What do you want to see change in the Valley to know that okay, we've made a difference?
I think we're on the path to that. A lot of organizations have started doing that. But I think for a while, it seemed like we weren't as good as utilizing our data in the most effective way. I think we would just collect it and just would have statistical data. I think when you think about data and think about even funding sources, writing a grant, they want to see what change you've made, right? So the data needs to be collected and maintained in a way that change is measured. What changed because of the work you're doing? And that has to be beyond, we served 40 people this year and now we're serving 80 people. It has to be beyond that. Like, what does serving mean? What did you address? And because of that, what change happened? What is a number for this as opposed to what was the number before? So that kind of minute outcome specific data is what puts us in a map of improvement that brings back the trust that even funders want in the people they are investing in. And in today's times, grants are so difficult to come, and you have to prove beyond the norm about the work that you're doing. And even to justify labor, employment, all of that, you need data that proves your work more than just statistical data.
Okay, yeah, to be able to qualify. The impact.
Yeah, and to actually have like a good narrative and a story on the change that you're making and its impact.
Well, I mean, this summit is going to be a huge driver of that change, because it's going to be eye-opening for so many people. Not just the poverty thing, but I mean, these are the only way that we can like, I guess, be informed, right, and educated on what access we have or how to help. So
Yes,
thank you for that.
it's
That's
yeah, it is very comprehensive. So you will see highlights of all sectors on what we're doing. It is also a proud moment to actually know that, a lot of times we ourselves think about our valley as a small place. We're not small. We're up there with the big runners,
thank you for saying that. Yeah.
Yeah, there's a lot here. UT or GV is huger than what you can think of right now. And we have almost all major health systems here. We have big businesses here. I think we don't have a lot of manufacturing going on, but other than that, you have all the big brands here. We have, culturally, a lot of very important factors that we're known for out here. And the youth here are excellent. We're very blessed to have a lot of volunteers for this organization. Since we are very small, we thrive on volunteers. And I want to say, I am so proud of our youth in Rio Grande Valley. They are so good. They have critical thinking. They think out of the box. They are solution driven, which is so different from what we have heard from the other generations. We only talk about problems. They are solution driven. So we give ourselves less credit to what we are. We're at par with a lot of big cities.
Thank you for mentioning that, because as locals, we tend to put ourselves down almost. Like, we become our own gatekeepers from, like, just the mental, the our perception of where we stand with the rest of society. Like, you're right. It's not a small town anymore. I mean, we have a school of medicine. We have a college football team that's starting. It's not. Maybe we just have the idea of what the Rio Grande Valley was decades ago, and that idea has stuck with us. But there's a lot to love about this area and to be proud of. So thank you for mentioning that. And I'll say one more thing too. I'll say it for Dr. Chandran, just because of her background in physical therapy. We got to get more walking too, right? We got to get movement going.
We gotta get movement. And I am myself being from the field, I'll tell you, sometimes it's hard. As you know, there's a lot of accidents if you're on the bike. So you are like, do I want to stay alive or do I want to look thin? So
the choices, right?
Yeah. So I think our city needs a little bit, and a lot of cities have done a good job putting walking trails. But again, the temperature is extorting. So there are some barriers to all of that. So we can have, it'd be nice to have some indoor rock climbing clubs, rappelling clubs, something interesting like that.
Yeah. There's actually a rock climbing club facility opening in Far.
That'd be great.
Yeah, it's I can't think of the name right now, but I've been speaking to the owner of it, and they're in the process of. It's going to be in Far for sure.
Yeah,
but that's going to be a big blessing, because
air
conditioning is a big deal here.
It is. It is.
So we're excited for that. Well, Dr. Chandran, thank you for being on the show.
Thank you for having me.
Thank you for the time. I'll tell you guys, Dr. Chandran came on a Saturday to talk to us, so really going out of her way so we can see the passion.
Thank you.
Especially as someone who's not native to the valley, thank you for paying attention to us the way that you and your organization have, because it's really
this is home. I came here 15 years ago. I have made my family here, my career here, and I am going to be here for the rest of my life. So this is my home, and I'm going to take care of my home.
There we go. Thank you for that. There we go. And thanks for helping us putting ourselves straight, that we should not be seeing ourselves as lower than we really are.
Not at all. No.
All right, guys. Well, if you want to meet Dr. Chandran, I guess you can see here on September 5th, right?
September 4th.
I've been saying the 5th.
Yes, it's 4th, the Thursday from 8 o'clock onwards, Harlingen Convention Center. And to register, please go to AltaCairAccelerator.com. You do not want to miss this summit. We have some amazing things going on there for everyone.
All right, guys. And if you think you had a hard time paying for your lunch, it's not the same as when you get in the simulator. I haven't been on it, but from what it sounds like, we got to check that one out. Well, thank you guys for another week on the Rio Grande podcast. We'll see you next week, and we'll see you on September 4th.
Thank you.
Thank you.